Good afternoon, everyone. This is Jennifer Yost from the National Collaborating Center for Methods and Tools. I am a team member here at NCCMT. Thank you all who have joined us this afternoon for our Spotlight series today on the Evidence-Informed Decision-Making Checklist from Health Evidence. Just a few housekeeping items. You can use the question and answer down at the bottom right-hand side to post comments and questions during the webinar. We will actually have a question and answer period with our presenter at the conclusion of the webinar, so please feel free to also post any questions that you might have for our presenter during the webinar, or you can just wait to post them during the question and answer period time. For any connection issues, we recommend using a wired connection versus a wireless, and you can reach the WebEx 24/7 helpline at any time, and we've posted that for you also in the chat section to your right-hand side of your screen. After today, if you would like to access either the PowerPoint or the audio recording of this webinar, they will be available via our SlideShare and YouTube accounts. The PowerPoint will also be available in French. So we have our first poll question of the day, and we'll have a few as we go throughout the webinar today. And we would just like to get a sense of how many people are watching the session today with you. So the great thing is we find that webinars are a great way for everyone to be connected across different areas at one time. So it looks like, as people are responding to the poll, thank you very much, that most people are watching just themselves, but we do have a few groups of people that are joining. So thank you very much to all of you who have responded. So as we move on, this is a webinar series for our Spotlight on Methods and Tools, so our registry of methods and tools, which I'll speak about in a moment. And this is the 22nd episode within our Spotlight, and as I mentioned, we are going to be featuring the Evidence-Informed Decision-Making Checklist from Health Evidence. And during the presentation, we will post links to both the tool and the summary statement in the chat section when our presenter gets to that. We'd also like to get a sense of where everyone is joining us from today. So where within Canada or outside of Canada are you joining us from? And it seems that we have a participant from British Columbia, some participants from Ontario, and some participants also from, let's see where else we have. I think we see Nova Scotia, which is great, and Newfoundland, and Nunavut as well, and the Yukon. So this is really great. Thank you so much to everyone who's responding. We're getting a really good cross-country, cross-national representation today, and we'll just go ahead and check. And we actually also have some people joining us from outside of Canada, so thank you to those of you who have joined us from outside of Canada. And for those of you who may not be familiar with the National Collaborating Center for Methods and Tools, we're one of 6 centers funded by the Public Health Agency of Canada that are located throughout the country, and we here at NCCMT are located at McMaster University in Hamilton. While the 4 of the NCCs focus on the use of research evidence in specific public health content areas, we focus on improving the access to and use of methods and tools that support moving research evidence into practice decisions related to public health practice programs and policy within Canada. So we go across content areas. These are just a few of the products and services that we offer here at the National Collaborating Center for Methods and Tools, and many of you may be familiar with them. And today we're going to highlight a method or tool, actually, that is located within our registry of methods and tools. And we'd also, as we go along today, we're just trying to also get a sense of what sector you're from, and this will sort of help our presenter today to possibly tailor some questions or tailor some content as we go along. So we see that we have the majority of people so far are public health practitioners. We have some people working in health in education, in research at the territorial or ministry level, as well as policy analysts, health practitioners. So it seems like we have a really good group, a really varied group of people joining us here today. So thank you for everyone who's responded to this question. So it will be my pleasure today to introduce our presenter, Donna Saliska, who is a Senior Knowledge Translation Advisor here at the National Collaborating Center. She was also the initial Scientific Director of the National Collaborating Center for Methods and Tools and was a professor in the School of Nursing at McMaster University. So it is my pleasure now to turn the presentation over to Donna. Thank you so much for joining us today, Donna.
Thank you, Jennifer, and thanks to all of you who have joined from across Canada and outside of Canada. It's exciting to see the group of people who are with us today. One other poll question, how familiar are you with the evidence-informed decision-making checklist from Health Evidence, which will be the topic today? If you could just answer the poll. Okay, we're not getting the technology, so we'll go on. So I thought I would start with what is evidence-informed decision-making. This is a model that if you've looked at any of the National Collaborating Center for Methods and Tools information, it will probably be familiar to you. One of the major messages of this model is that evidence-informed public health or evidence-informed decision-making is not just about applying research, the research findings to a particular problem, but it's combining what you find in the research with what your understanding is about the local context, the community health issues, the epidemiological data, preferences of the population, political preferences, what resources you have, and using your tacit knowledge, the expertise you have about your population and public health practice, and putting those all together. So it's not just about applying research blindly without all these other factors. Sometimes the research plays a minor role, often resources plays a major role, but ideally you're at least considering all of those aspects when you're thinking about evidence-informed public health. And we've put this process into a stepwise circular process that is really a problem-solving model that's just expanded a bit. So beginning with defining the questions, doing an efficient search of the research literature, the critical appraisal if you don't find pre-appraised information, synthesizing what you find in terms of getting an actionable message. Are you, is the research such that you are going to start a program or consider starting a program versus considering taking away a program, so de-implementing a program. The adapt stage is really about thinking of whether or not this implementation or de-implementation can work in your community. So this is where you bring in aspects of community and political preferences and the resources you have. Can you do the same level of intensity as was evaluated in an effectiveness study? So really considering whether or not we could expect the same kind of reach and effect by implementing or de-implementing some practice in public health in your community. The next stage is actually implementing the change in practice, the putting into place a new program or taking away a program and then evaluating it. And the evaluation really has to be planned far in advance of the implementation so that you are able to evaluate hopefully two things. One is the impact of the implementation strategies on the public health practitioners or the people who will be doing the program or stopping the program. Can you actually get the practitioners to change their behavior? And then critically important is then what difference does it make for the population? Have you altered the extent of the problem that you started the cycle with? So it takes you back to redefining the problem. So I'll stop here just to see if you have any questions. Okay. All right, I'll keep going. Another poll question, do you currently have a way to track your evidence-informed decision-making process? Most of you responded that you weren't familiar with the health evidence tool. Okay, most of you are in the no phase. You don't currently have a way to track the process. Another question is, there were a few of you who did have a tool, if you could write in the chat whether you're using something else. So one or two of you were using health evidence. If you're not using health evidence but a different tool, what is that tool that you're using? Okay, must be not many of you using the tool. So I'm going to talk to you in a bit more depth then about the health evidence tool. It's a checklist for evidence-informed decision-making. And just to acknowledge that the people who developed this were at Health Evidence at the time. Paula Robeson and Cara Corby both had something to do with this tool. They were working with people in Peel Public Health who were also identifying a need for a tool like this to follow the process of evidence-informed decision-making. So it was definitely a joint effort to develop and try out this tool and modify this tool. You can find the tool in the registry, as Jenny mentioned at the beginning. It's also directly available on Health Evidence. That's the second part of this slide where it says download this tool. You can get it directly from Health Evidence. There is a French version that will be in the registry shortly. We had hoped to have it up for today, but didn't quite make it. But for those who would prefer a French language version, it will be available through the registry very shortly, or on the Health Evidence French page. There will be a click-on spot, a link for you to link to the French language version. So that's coming soon. It's just a screenshot of what the tool looks like. It's a one-page tool, but it actually incorporates a tremendous amount of work. So I'm going to go through sections of it to give you a sense of what you're looking for when you do this checklist. So I know at Peel they've used the checklist as a kind of a guide to help people who are planning the process, and they've also used it at the manager's level to understand to what extent the staff have followed an evidence-informed decision-making process. So we'll just go through each section of it in a bit more detail. And please send me some chat questions if you have any. So the first phase, as you saw in the wheel diagram, was defining the question. So the question for a manager would be, was there a clear, answerable search question developed? And PICO, you probably know, stands for the population, the intervention, the comparison, the outcome. If it's an exposure kind of question, a causation kind of question, etiology, then it would be a PECO. And if it's more of a contextual question about what's the experience of people who have participated in an intervention like this, then it would be a P and the S, the population and the situation. That would lead you to look more at qualitative research. You'll see on the right-hand side, it's a place for you to track. It says file path or link to the saved location. So there's an expectation that within your shared drive of your particular place of employment, you would have this information that anyone who was looking at this checklist would be able to go and find that information in much more detail. So that's the question phase. The search, as I mentioned, it's about doing an efficient search. So the criteria here says, was a comprehensive search strategy employed to find the best available evidence to address this question? So there's an expectation that you have search terms, and there's a suggestion of another tool here that's on Health Evidence that actually asks you for synonyms for each of the PICO or the PECO or the PS. So the tool would allow you to get all the search terms in place, and again, for you to save that in a common file path that people could find. It also asks you for the years that you searched, so what are the dates? It asks you for what levels of the search pyramid you searched. So you might have noticed on our website there are a number of search pyramids that are there for different topics. There's a general public health one, and then there are some lifestyle ones for children, for adults. Anyway, I think there's 6 or 7 different pyramids now. But the idea of the search pyramid is that you start with the most highly synthesized. So for public health, that would be at the guideline level. And if you find nothing of relevance or recent high-quality information at the guideline level, you would go to the systematic review level next. And then if there's nothing, again, that's high-quality or recent enough, then you would go down to the single studies. But searching those levels first is a more efficient way than searching everything at once or searching single studies, which is what most people tend to do. So this is asking you to report on where you searched in the search pyramids and what you found in terms of numbers of articles at each level. So the search results will be kept in a flowchart, and you'll see in the rest of this checkbox about the flowchart. They're asking if you how many articles you got in total, how many you had after a title and abstract review, and then how many you had left that met your inclusion-exclusion criteria at the full text review. So it's this process is, again, trying to streamline and speed up the process of getting to relevant, high-quality information rather than being given a search for thousands of articles that you have no time to get through in an orderly fashion. So the flow chart allows you to keep track of that all in one page. And again, you would be keeping that document where that document is located on the right-hand side, so anybody reviewing this flow chart could find it. Here in the middle, too, it also says that you've saved your references to a reference manager software database. Many public health departments now in Canada are using, for a health department, have negotiated for a particular reference manager software database. So there's something called Mendeley, there's EndNote. Reference Manager is one of the older ones now, RefWorks. So it's a matter of an orderly way to keep track of your citations, what you found useful. You can set keywords. So again, where is that document kept on your shared file? The next level after you've gone through this search for high-quality evidence is to actually do the critical appraisal. If you're lucky enough to have found some of the evidence in a pre-appraised database like Health Evidence, for example, where 2 people have already independently done the critical appraisal and agreed on the assessment, it would save you this step. But if you have used only pre-appraised information, again, it would be useful to keep track of that. The fact that the score is 9, for example, out of 10, and you know that was from Health Evidence, so 2 people have done it. Otherwise, you're going to have to do the critical appraisal for yourself, and again, keep that critical appraisal in a file path that would be available to people. So people would be able to do spot checks about do they agree with your critical appraisal. This also involves making a decision about what tool is the best tool to use. So on our NCCMT website, again, we have a tool that helps you find what are the best tools for public health information at the guideline level, at the systematic review level, at the intervention single studies level, at the exposure level, qualitative research level. So there are many different tools that fit different kinds of evidence at this stage. There's a little note between 3 and 4 that says how many papers were remaining after the quality assessment. So if you ended up with a very large number of studies or a large number of reviews, you might decide to not consider the lower quality, but just consider the higher quality recent evidence. So again, it would be an issue of putting that information in the flowchart. Stage 4 is the synthesis piece. So what are the results? And I think this is an even more important part of this stage, saying what actually is the actionable message from the evidence? Does the evidence give you a clear indication of what works or what doesn't work? What would work for particular populations? What would work in a particular season, for example? So what is the message that you would take from this evidence in relation to the problem that you've identified? Taking that evidence to the next stage, it's the adapt. And I mentioned as we were reviewing the tool, the circle, that the adapt is really trying to look at, could this information work in your population? Does it meet the mandate of your organization, the current political powers that be, the current climate in your community, current needs of your population? What's the possibility in terms of reach? How many resources would it take for training, for implementation, for de-implementation? So those tools are listed here. And again, if you used one of these tools like the NCCMT applicability and transferability tool, you would document how you use that and keep that file path here for anyone to go and look at it. The last two stages look very simple. 2 words, implement and evaluate, but in fact there's a lot of work that goes into implementing a strategy if you're going to put in place a new program or de-implementing an old program. So the strategies in terms of communication and getting the resources together and strategies that will get public health practitioners to change their behavior. We all know that policies happen first, but policies are never enough to actually get people to change their practice. So how do you get people to change their practice? And as I said earlier, the evaluation is, were you successful in changing practice, but then what impact did it have on the population? So the plan for implementation needs to be documented and have a file path, and the plan for how you will evaluate, because the evaluation is critical to have in place before you do the implementation. So this one-page tool would lead you to all of the documents that support this process we've said on the right-hand side. So that's a whirlwind of the tool. It can be used as a guide, as I said, to how you're planning and functioning, where you're keeping the documentation that goes with this, and it can be used as a checklist by a manager, supervisor, to see how complete the process has been for the staff at the health department. I'm just going to stop there for a moment to see if there are any questions. Okay, I'm going to move on then. Another polling question. Whose job, where you work, whose job is it to do evidence-informed decision-making? Is it particular to anyone in particular? You're not sure, is it managers, directors, specialist? Is it everyone, or is it somebody else? I haven't listed. Okay, it looks like the answers are pretty much spread out, but a more common answer is that it's everyone's job. I think that's, I'm seeing that trend definitely in different health departments that we're working with, that it is becoming everyone's job, that they're trying to get specific skills in particular levels, but and more of a train the trainer where a particular group is being trained with more skills to help other people in the health department. But there's also an expectation, I think, that new graduates come with these skills and can help others in the health department when they're hired there. The reason I asked this question is because I think it's a particularly important tool for people who are managers to see how this process is being conducted. We actually created for people to get more information about each one of these steps. There are a number of modules online for the NCCMT, including there's a large introductory module that's 4 or 5 hours. That's the overall process, going through all of those stages in the wheel. And then there are a number of critical appraisal ones for different kinds of studies. And then the adapt phase, the implementation, and the evaluation phase. The feedback that we had is that even this introduction to evidence-informed decision-making at 4 to 5 hours is too much for people to get started in. So we have moved that 4 to 5 hours into a really shortened version. Down here at the bottom it says EIDM Essentials, Key Issues in Evidence-Informed Decision-Making. So that's more like a taster to get you through the stages of the process that would lead you, if you had more time then, to go back to this overall 4 to 5 hours introduction to evidence-informed decision-making. But then we took the evidence-informed decision-making checklist and put that in a 1-hour introductory module that's specifically directed to managers. So maybe managers don't need to know the specifics about critical appraisal of guidelines or ecological studies, for example, but they need an appreciation of how much time that takes. They need to understand what goes into a search and how long it takes to get through the title and abstract and the full text of the search. They need to understand the thought and the meeting time that goes into the applicability and transferability tools. So this was taking the checklist and putting it into a format for managers to consider what they need to know when their staff are going through an evidence-informed decision-making. Not that they could lead the details of it, but at least they could use the checklist to make sure that the staff have been thorough in how the process has happened. So I just did a screenshot of what that module looks like in a bit more detail, and it's intended to be about an hour to get through for managers. If you just wanted more detail about the checklist itself after today, you could also go there. So that's the formal presentation, and if you have any questions, we can open the chat now.
Great, Tana. Thank you so much. So just a reminder to everyone that please, if you have a question for Donna, we do have some time today for her to take your questions. And you can either post them in the chat or the Q&A. And so we'll give some time for people to go ahead and do that. And so we have one question from Benjamin and comment that your evidence-informed decision-making tool doesn't take into consideration evidence from practice. So Donna, would you be able to respond to that, please?
Sure. Is there a fast way to get back to the, or is this the fastest way?
Probably that is probably
Okay.
the fastest way.
Okay.
Sorry, Donna.
That's okay. Good question, and that is, I guess, not at all what we had intended for how we think evidence-informed public health happens, but it's a common misconception, I would say. So in this model, public health expertise to me is all of that. I said tacit knowledge, but it's all that you know from your experience in public health, working in public health, how you build up that that expertise from the novice to expert kind of growth that happens in everyone who works in public health. That's a really critical piece of evidence-informed decision-making, because you need that expertise to be able to define the problem. You need the expertise to think about the local context, the community and political preferences. You know about the public health resources and what's likely to be available. So I think that experiential piece is a really critical part of this this model and the decision making. So one of the reasons I think it ends up sounding like we're only talking about research, this bottom portion, is because I think our expertise has long served us very well in working through public health problems, but for the most part we've ignored the research. And I think this process is really just trying to formally introduce the research aspect into the entire process. And where it comes in again then is in the applicability and transferability tool in the adapt phase. It really requires that you use your public health expertise to to bring the information you have, but then to help make the decision about would this work in our community. So I'm definitely open to other interpretations, but hope that answered your question.
Great, thank you, Donna. And we have a question from Kristen Hurd. Kristen wants to know, if teams were going to start out fresh with using this tool in program planning and development, how long would you recommend they plan for this process to take? Could you even estimate the average amount of time it takes to get through?
Yeah, it's a very good question, because too often it's left until the program plans are due, say, in a month, and that's not enough time. Probably the best time to start the process is at the end of the planning cycle. So just when you've got the plans complete for the next year, you can start thinking about, for your community, where are the unmet needs, or where are the issues that you're thinking have not been addressed adequately. And that will give you, so I'm saying about a year in advance. At the end of one planning cycle, you're starting to think through the next year. That will help you go through the possibilities of prioritizing problems. And I think you can't get through, as a team, more than 2 or 3 of these problems each year. So if you prioritize what the problem is that you're going to be searching for, defining over the next year, you could work at a manageable pace given your other workload, work through the 2 or 3 priority problems in this whole process. So that would give you unrushed time to consider each of these phases thoroughly before the next planning cycle.
Great. Thank you, Donna. And of course, we're happy to hear back from anyone who has posted a question that Donna's addressed. Any further comments or follow-up that you need in terms of having your question addressed. We have a question from Natalie Oak, who has said, thank you for a great presentation. Thank you, Natalie, and thank you, Donna. And Natalie was wondering, I wonder if you would be able to speak to the order of tackling the components of EIDM. In a current case for me, it makes sense to do the research piece last. Is this unusual?
I'm not sure, Natalie, what you mean by the research piece last. Does that mean that you've collected the epi data, you've thought about all those adapt pieces, the the local context, the political context, and all that before you've started looking for the research. If that's what you mean, I'm wondering if that limits your thinking. I'm just thinking out loud now. When we presented the applicability and transferability tool to the provincial medical officers of health, I'm just going back to that. Yes. So the ADAPT tool is based on questions that use information from all of these 5 overlapping circles. And when I presented that tool to the provincial medical officers of health, they said for them, they only need to think about the political preferences, that they don't need any of the questions about the community context or the research or the resources or the public health expertise. It's kind of like, from their perspective, the political preferences are the key to what's allowable. So from that, I could see perhaps a similar state. If you know, for example, that safe injection sites are not going to fly in your community, there's no reason to start with looking whether or not that's effective. But you might start more broadly, but with what are ways of reducing HIV transmission and sexually transmitted diseases, for example. You might start with the research still in that case. I think probably the main issue is to start with what are the problems in your community, what's the epi-data telling you, and what sense do you have of what's working and not working, and find the research to answer those questions. I'd be happy to hear from others.
Great, thank you, Donna. And we do have another question, but I'll just make sure that it wasn't Natalie. She said thanks for your response. She has another question, but we'll get to another question that someone has posted. And Paula Baker, Donna, would like to know, at times we are gathering information, data, etc., from our own public health documents. So a document review process is used. What tools and templates can we use for this?
I guess you're probably using the document review for problem identification and probably for evaluation. I think those tools and templates, there are some examples, and perhaps if you emailed me the question again, I could find some of those. But the key issue is to develop your own template for the data extraction that suits the question. So, particular questions will have data extraction about different populations, about different levels of intensity, about differentially how an intervention impacts on an outcome, on a population, different outcomes affected. I think it's probably better to explore the development of your own tool for each one of those situations, because there would be specifics to the problem that you're trying to address. Sorry, that's probably not what you hoped for, but probably better to do that and have a trial of the data extraction from the documents and see if you need to modify it.
Great, thank you, Donna. And so Natalie had actually just followed up with her question, so I apologize for that, everyone. And Natalie had said, for some context, the PICO question is more about understanding and identifying gaps. This would be, this would then inform the research that they seek. So I think, Donna, you've sort of addressed that, but if you have any other thoughts on that.
No, I think that's really the place to start with. What's the local data telling you about where are some unaddressed questions, where are the gaps, or what are the public health expertise? What are your hunches about what's working and not working for your program and your population? So thanks, Natalie.
Great, thank you, everyone. And we still have a few more minutes, of course, for any comments or questions that anyone has. And great, so I see that we have another question from Donnie Sampson. Very clear process, a simplistic approach to an overwhelming issue. Your statement about looking at research blindly is so important, as it must be combined with other external variables, for example, community, politics, available resource, and the population needs. So not so much a question, Donna, a comment, but I don't know if you have a comment back to Donnie.
No, I think that's a great summary, Donnie, that just reinforces my point. So thanks for making that.
Great, thank you. So another question from Kristen Hurd as well. Can you talk a little more about the PICO versus PECO versus PSCO?
Okay, I don't know what PSCO, but we were talking about PS. So if you are concerned, let me think of an example from Peel when we were using this tool. There was a concern that a lot of, and it comes up at this time of the year, a lot of time and effort was going into the Quit to Win, the contest where you sign up to stop smoking and you have the potential to win a car in your community. So that would be considered an intervention. The population are aimed at smokers. The intervention is this Quit to Win, where you sign up and you have the lottery potential of winning a car. The comparison is whatever is the usual. You know, you have the option to use nicotine patch to get, you call it with the needles, acupuncture.
Yeah.
Acupuncture, you know, there are lots of different things you could compare it to. And the outcome is actually smoking cessation or reduced smoking. So that's a PICO. It's looking at framing a question about an intervention, whereas PECO is framing a question about causation, etiology, or exposure. So in fact, one of my favorite examples that came up a few years ago is if cell phone use in kids causes brain cancer, brain tumors. So the population there are, say, children under 18. The E, exposure, is cell phone use, and particularly not hands-free when they've got the cell phone up to their ears and there's a lot of time on the phone. The comparison is no cell phone use, and the outcome are brain tumors. So it's a way of expressing the question about exposure. And these formats actually came from the assistance of librarians. They said if you can clearly identify these PICO, PECO kinds of questions, it's much easier to do the search, to do an efficient search. The last one is PS. So it's about when you're trying to understand context. What's the meaning of having a safe injection site in your neighborhood? The population then is this neighborhood. What's the community reaction? The situation is the establishment of a safe injection site in that community. So again, it's a search strategy. If you can be this specific about the PICO, PECO, or PS, it really helps you to do an efficient search.
Great, thank you so much, Donna. And we have, again, of course, we still have some time for some more questions and comments, so please feel free to post them in the chat or the Q&A session. And while we wait to see if there's any more questions that come through, we'll just sort of move ahead towards the conclusion of the webinar. But again, if any more questions come through, then we can certainly address those, because we do have a few more minutes, of course. So your feedback is very important to us here at NCCMT, and we have just posted a link in our chat box. So please, if you have a few minutes, complete a short survey to tell us how we're doing with our webinars and how the feedback on today's webinar specifically will help us to improve going forward. And so we have a next polling question, our last polling question for you today. And so we would sort of just like to know, what are your next steps? What do you plan to do after today? So do you plan to access the checklist, read the summary statement of the EIDM checklist, which we have, the link was also posted in the chat? consider using the checklist in practice or tell a colleague. And again, you can select all that it applies, so you're not limited to just one next step. And we're seeing a varied range of all of the responses available. So it sounds that we've done a little bit of our job today. Donna has done a great job in setting the stage for us, so hopefully you will find it useful in practice. And while we're waiting just another moment to see if we have any comments or questions from Donna, I would just like to take a moment to thank everyone today, and I'm just going to move ahead and see what we had after this. Oh, yes, thank you. Reminding myself what we have ahead. So we do have an upcoming webinar on March 9th. That is from 1 o'clock to 2:30 p.m., same time, same place, on the Contextualizing Guidelines Workbook. So we'll have one of the tool developers available with us to talk to us about the workbook and how this can be used to contextualize policy recommendations to the local context, which is really great. And so I would also, I'm going to post in a moment when I pass it over to give Donna the last word of the day, but I would also just like to take the moment to tell you about a study that we are conducting that is Canada-wide, and it is a knowledge to action study funded by the Canadian Institute of Health Research. And so all public health professionals are welcome to participate in this study, and we're looking at 3 different ways to get evidence, high-quality, high-synthesized evidence out to public health practitioners working in cancer prevention, and how this might affect, influence positively the use of evidence in practice. So in a moment, I will just post a link to that, so please feel free to, if you are interested, have a look at participating in this study. So again, I'm not seeing any further questions or comments come through for us here today. I would like to thank everyone for coming today to our webinar. I'd like to thank Donna for being such a wonderful presenter. She's so knowledgeable, so it's always so great to have her with us. And Donna, I'll just turn it over to you for any, last-minute words of wisdom that you might have for our participants today, because you're always full of them. So, right. Donna, over to you before we close today.
Okay, I'm fresh out. I think you said it. That it's great to have people participating online and great questions. And yes, thanks for your involvement today. We'll sign off?
Yeah, so that will sign us off for today, and thank you to everyone who has joined us, and we'll see you again hopefully soon. Bye, everyone.